My name is Jorge Flores Araoz. I'm born in Peru. In the past years, I have been traveling to the 5 continents to meet people and do certain healing work.
My name is Dr. Orli Etingin. I'm an internist here in New York. I grew up here in New York. I am the child of 2 immigrants. So I was one of the first in my family to go to professional school after college.
My father was an intellectual. He had a magazine, a cultural magazine, for 25 years, and he wrote some books about Peruvian culture. And my mother was an actress, a theater actress. I was very drawn by science. I felt very comfortable with it. I got good qualifications, and I went to study agronomics in the main Peruvian university for agronomical science. And I was doing very fine. I was feeling very good there. And, but I left my studies very close to the end of them. And the only reason was because at the time I discovered something else that caught my attention and caught my heart. And maybe it's because it's the age of the big passions that I feel I couldn't do both things at the same time. I really felt that I have to give my heart to something completely.
I was always taught by my parents that it was good to have a passion about what you did. So I was curious about how the body actually functioned. And from the time that I was probably about 12 or 13 years old, I was really interested in understanding the function of the body. And so I started pursuing more science courses in high school. And then when I got to college, I became more interested in the sciences. And ultimately, I originally thought that I would be a geneticist or a scientist, but ultimately I really found that the thing that gave me the most pleasure was really to be able to teach about the human body and to engage other people in their own health.
If I compare what I was feeling from the agronomical studies and what I was getting from my teachers about the energy, about the subtle reality of the world, I can say that my sensation of connecting a real truth of life was stronger for the energy world. So I devoted myself completely to that when I was around 19 or 20 years old. And I'm trying to rationalize it now, but in fact everything is a feeling. And when I was at the same time trying to keep my studies, my formal studies, the joy and the passion was not there anymore. Even more, I was feeling that one part of my wild self was taken to domestication and formatting, and that became unbearable for a while. And it was an important decision. I think I caused to my parents and to my family a big shock, you know, because my whole family is very well connected with, if you want, the modern Western establishment, and the things that I was doing were kind of not easy to understand. But at the time, I don't know, it's maybe the flame of the 20s, you know, for me it was the only way I could really feel alive doing those things.
And so from the time that I was a student in college and volunteered in a lot of healthcare settings, I decided that I was going to go to medical school. And I went to medical school at Albert Einstein, a very traditional Western medicine university. But one of the things that was special about Einstein was that they were, at a time, a little bit avant-garde in terms of their understanding of the whole body. And they introduced the concept of the entire body as part of the patient and this holistic approach to human disease. And they introduced us to patients very, very early in training. So it wasn't just the coursework and the science, but the contact with patients and the human contact that was a very early part of the Einstein curriculum. And then when I graduated, I came to New York Presbyterian Hospital, which was the place that I wanted to train, to Cornell Medical College, which at the time was still called Cornell, not Weill Cornell. And I spent my entire career of training there. And I trained as a medical resident and a hematology resident. And then I stayed on the faculty. And I've been on the faculty for many years as a teacher, as a clinician, and sometimes doing some research as well.
Those years that I was training, I trained with 5 different Chinese teachers of different disciplines. All of them, they had different approaches. Also, some of them were have different spiritual approaches. But at the end of learning with them, I started to give sessions using the flow of vital energy that I learned from that training. I have to say that at the time, it was not difficult for me to connect with the energy and with the flow. It became very, very natural. So I learned how to project it, and I was working with people that had different kind of illnesses and things, and I was getting some results. But at the time, everything was about the vital energy, and if you want, kind of plugging the body to a charger. And that charging connection was producing some stimulation on the self-healing possibilities of the body. But nothing was touching the soul, and nothing was touching, if you want, the exploration of the self from another point of view. That came a lot later.
So how long have you practiced, Jorge?
Well, I started doing my first sessions on 91, but this modus that I have now, maybe since 2005, 2004. And I continue, of course, discovering new things and more subtleties. I don't know exactly how my practice is going to evolve. And you, doctor?
I've been practicing since about 93. And, you know, when you say that it's evolved, I feel like my practice has evolved too. And part of the reason, and I tell this to medical students, is that's why they call it practice. Because you're not the same doctor, healer, 20 years later as you were then. I mean, you're shaped by the experiences of your patients, you're shaped by, you know, so many things. I mean, what do you think were the biggest things that sort of shaped you into the practitioner you are now?
I'm thinking about 2 things. One is the approach. I think as I got older, I relaxed more about certain things. And so, if you want, the tools of connecting with the non-conscious part of the patient are more smooth now. And I think the appliance of certain acknowledgements about life in my own life makes me a better healer. What I understand about my patients and how they got to certain problems or situations and how they got out of those situations are very strong lessons of life for me. And if I apply them, it's kind of then also I improve my capacities and my practice. And I have to say that I have been very moved hearing you, because in those years when I was in my early 30s working at the hospitals, I was kind of knocking the door and wishing to meet some of the doctors that were at the hospitals to have a dialogue like this one and the possibilities of approaching together something. But it didn't happen, and there were great doctors there, but I think that maybe the industrialization of a big social security program doesn't allow too much room. You know, everybody was on a hurry, and they were applying these kind of short minutes to everybody, and everything was around painkillers, and it was not too much room to touch that part that needs to be touched in order to help people. So I have to say that I am very moved to meet you and to understand your approach?
Well, I think that there are so many similarities. In other words, we are pressed in medicine to be productive, to solve problems, to be efficient. And there has to be a balance between that and taking care of the whole patient, because you really can't accomplish your goals if you don't.